Hello, so today I want to talk about teen dating violence. And the reason I want to talk about this today is because it's simply a public health concern. Studies show that about 72% of 8th and ninth graders report that they date. So that's a pretty significant portion of our 8th and ninth graders. And we all know that maturity is still a factor in dating at this age. And so we have to make sure that not only are we educated about teen dating violence, but so are our young people. So I want to cover a few things with you today. So I want to just first of all explain the fact that dating violence, it occurs between two people that are in an intimate relationship. And in addition to that, the nature of dating violence can be emotional, it can be physical, and of course, it can be sexual. So let's kind of break that down a little bit. The emotional part of dating violence occurs when one or more, one or both parties, do things like bullying and teasing and making the other person's self worth deteriorate. Doing things like, just kind of making them feel bad and teasing them, calling names and things like that. And then the physical component comes in when there's pushing or biting or pinching or shoving. And then naturally, the sexual part is when one or both parties are forced to engage in some type of sexual act against their consent. Now, we all know that consent means something different to different people. And this can be a very gray area that really needs to be explained to our young people. They need to understand what consent truly means. So, we need to explain to them that it's not just a person saying no. It's also when a person says no, that you don't continue to try and wear them down and continue to try to convince and persuade. You don't continue to try to touch and kind of force your way onto them until they give in, because giving in is not consent. And that's what we need to help our young people understand. Giving in, pressuring a person until they have given in is not consent. We need to make sure they understand no means no and consent means both people are wanting to engage in whatever is going on. Okay, so also just wanted to make note of the fact that unhealthy relationships can start at a very young age and progress into adulthood. So if a person starts out with unhealthy and violent habits in dating at a young age, if it is not caught early enough, they may go into adulthood with these same behaviors and think that these behaviors are appropriate or acceptable in intimate relationships. So that can carry on into numerous other relationships and be problematic. So why is dating violence, especially with our teens, why is this a public health concern? One of the main reasons it's a public health concern is because 1 in 4 adolescents report that they have experienced some type of verbal, physical, emotional, or sexual abuse from a partner within a year's time. So 1 in 4, that is a pretty significant number. And I think that too many of us are ignoring these numbers. And then also, it should be noted that about 10% of students nationwide report being physically hurt by a boyfriend or girlfriend within the past 12 months. So these are surveys done by or done during schools or at schools. So how does dating violence affect a person's health? When we think of dating violence, we don't really think of it affecting a person's health, but it absolutely does. It can result in depression, anxiety, even thoughts of suicide. And it can also result in deterioration in academic performance, and just isolation, social withdrawal, and things like that. So, just so that you know, physically abused teens are 3 times more likely than non abused teens to experience some type of violence in college. And they're also at a high risk for getting involved in drugs and alcohol as well as an unhealthy coping skill. Okay, so Who's at risk for dating violence? Good question. So studies show that people who harm their partners are more depressed and they're typically more aggressive in general than people who do not harm their partners. Now, I really want to make sure that you understand that this is not just someone who hits their partner or forces them into sex. It's also verbal and emotional abuse. That's also dating violence. So I just want to make sure that we're clear on that. Because sometimes when you hurt a person emotionally, it can be just as painful as physical abuse. So, anyway, so warning signs for a person who's at risk for being violent during dating or in relationships: a person with poor social skills, a person who has a hard time managing their anger, a person who has a hard time resolving conflict or problem solving, a person who has more traditional ideas about the roles between men and women. And then and that is not always, but they just might be at a higher risk because they don't quite understand, especially a young person who isn't mature enough to understand the roles and what that actually means versus, one person dominating the other, and so on and so forth. So also a young person who witnesses violence at home is also at a much higher risk than someone who has never witnessed any type of violence at home. Someone who's having behavioral problems in other areas, also someone who has witnessed this type of violence somewhere in the community, or they have a friend who has engaged in this type of behavior. So sometimes it's who you associate with or the area you live in. If that is something that you've seen as acceptable behavior somewhere, you would be at a higher risk. All right. So how can we prevent dating violence? Well, obviously education is key. So the ultimate goal is to stop dating violence before it starts, especially with our young people. So we have to have strategies. This is vital to preventing dating violence. So during the preteen and teen years, this is a time when our young people are learning healthy relationships. They're learning how to interact with other people in a healthy manner and what intimate relationships consist of. So this is a really critical time for us to teach them these skills. So we should be promoting healthy relationships and preventative patterns and strategies for behavior during this time. So there are prevention programs are out there that some school districts have adopted throughout our nation. So you might want to check to see if your school district has one. If they don't, you might want to suggest it. So one example is called Safe Dates. It's a school-based program, and it's designed to change social norms and improve problem-solving skills as it relates to dating. So something to look into. Now, the Centers for Disease Control also have like a prevention approach, not just to dating violence, but to all problems that are a public health concern in our society. So they do a lot of research and collect data to determine if there is a problem and who it's a problem for, and they react or respond accordingly. So I will post on my Facebook page. It's Carmel Brown Counseling, Coaching, and Consulting on Facebook. Some different resources that you could check into. The National Domestic Violence Hotline is one, National Sexual Assault Hotline, National Sexual Violence Resource Center, and the National Youth Violence Prevention Resource Center, which is a really important one based on what we're talking about here today. So if you have young people, even if they're not dating yet, this is important that you explain to them the dangers of dating violence. Most of us don't assume that our young people will engage in any type of violent or aggressive behavior when they're dating. We just assume that they know better. But guess what? They don't. And not only do we have to teach our girls, but we also have to teach our boys. So all teens and preteens should be taught what's appropriate and what's not appropriate in dating. Because guess what? These young people turn into adults who are aggressive in relationships, or adults who allow aggression in relationships. That's all I have for today. Contact me, inbox me if you have any questions about anything that I've talked about today. Hey, today's Therapy Thursday. It's been nice.